there, I'm Teresa Dufour with today's CT Style Express. For some couples, having a child isn't always easy and they need some extra assistance. The Center for Advanced Reproductive Services can help. We have the medical director, Dr. Claudio Benadiva, joining us via Zoom. Doctor, thank you so much for making time for us.
Thank you, my pleasure.
So first off, talk to us a little bit about some of the treatment plans that you can provide for a couple who are trying to conceive.
Well, when we see a new patient that comes for a treatment of infertility, basically we start with their evaluation to try to find out what the problem is. A lot of times we find we are able to determine what the issue is and we try to fix that problem. Sometimes we just don't find, and it's what we call unexplained infertility. So we try to tailor the treatments for each specific problem the patients have. So we have a whole variety of treatments that we can offer depending what we are trying to accomplish.
Sure, and today we're focusing on pre-implantation genetic testing. Tell us what that's all about.
Well, Preimplantation Genetic Testing, or PGT, as it is known now, is basically a genetic testing of the embryos before they are implanted. That's where the name comes from. So preimplantation. So we create embryos in the lab, in a petri dish. Then we're going to test each embryo. That involves removing a couple cells, a few cells from each embryo, send the cells to a genetic lab that will perform specific genetic testing depending on what we're looking for. And then we implant one normal embryo back into the patient. So that's the PGT testing.
Sure. Are there different types of that, I'm assuming?
Yes, there are different types, and the definitions have been refined over the years. So there's a lot of different PGTs now, and there's PGT-A, PGT-M. So just to make it simple, when we do testing for the chromosomes of the embryos, a normal embryo is supposed to have 46 chromosomes. If they have more or they have less, that can create problems. It will not implant, or it can miscarry, or it can result in a baby with Down syndrome. Those are all chromosome problems in the number of chromosomes. That's called PGT-A. So that's one very, very common, very popular form of PGT testing. There are couples that come to see us because they have a specific genetic disease that runs in the family, or they know they carry a specific disease, for example, cystic fibrosis, muscular dystrophy, sickle cell. Pretty much every day we see somebody with a different problem, and they want to have a healthy baby, or they already have a child that was affected, or they found out because there is a family history. So we can test the embryos for that specific disease that the patient or that couple carries, and make sure that we implant an embryo that doesn't have it, that is not affected by the disease. That's a different testing. It's called PGT-M, and it's just specific for that patient.
Do all of your patients go through this, or like you said, they have to have a family history, or at what point do you do the genetic testing?
No, not all the patients. These are patients that, number one, usually need in vitro fertilization to do this. Age is a very common factor. As women get older, they have more risk for Down syndrome, more risk for miscarriages. So doing this testing before the embryos are implanted it could be very helpful. So that's one of the reasons. So definitely not for all the patients. But people have different type of motivations or different type of reasons, and we're really doing more and more, because more and more patients are interested in having a healthy baby and try to use as much of the technology that we have available to help with that.
Absolutely. And doctor, when should a couple initially seek help? After how long, or is it the mother's age? How does that factor in?
Well, in general, depending on the age of the patient, if they are less than 35 years old, after trying for 12 months, that's what's been recommended or considered as the definition of infertility. If the female is over 35, it's after 6 months.
Okay.
Because time is critical, so it shouldn't wait that long. Of course, if somebody already knows that they have a problem, because they have already been tested or had surgery before, then there's no reason to wait. If you already know that there's something that's not right, the sooner the better, I would say.
Right, absolutely. Well, Dr. Benadiva, thank you so much for all of the information. We're just getting into the start of it. But of course, if our viewers have more questions, they can reach you over at UConnFertility.com. We appreciate your expertise.
Thank you.